Hello, my name is Kimberly Hammonds, and I'm here to discuss the oral health issues in the United States. So how are Americans suffering from oral health issues? You have children that are suffering from dental caries or tooth decay, which is the single most common chronic childhood disease and is 5 times more likely to happen to a child than asthma and 7 times more common than hay fever. And also 50% of children aged 5 to 9 have had at least one cavity or filling, and that proportion increases to 78% among 17-year-olds. Also, you have adults that are suffering from periodontal diseases. So 1 out of every 2 American adults aged 30 and over have periodontal disease. According to recent findings from Centers of Disease Control, a study of prevalence and periodontitis in adults have shown that 47% of American adults have mild to moderate severe periodontitis, which is the more advanced stage of periodontal disease, and the rates skyrocket to 70.1% once the adults reach the age of 65. And also you have lack of dental insurance, which is a result of low income. So medical insurance is a strong predictor of access to care for children. Uninsured children are 2.5 times more likely than insured children to have issues and not be able to receive dental care. So children from families without dental insurance are 3 times more likely to have dental needs than children either in public or private school. So now that we know that oral health is a problem, what are we going to do about it? So you have the CDC. The goal of the CDC is to eradicate oral health issues in the United States. And they're going to do that by their plan of, it's like an 8-step goal that they have. And a few of them, of the 8-step goals, are prevention and control of dental caries, periodontal diseases, pharyngeal cancers. They also work to eliminate disparities in oral health and to increase effectiveness and efficiency of the oral health program. The 2 that we'll be discussing today is prevention and control of caries and prevention and control of periodontal diseases. So let's get started with the prevention and control of periodontal diseases. The CDC has 2 strategies to prevent and control. We're actually going to start with the prevention and control of dental caries. I apologize. The CDC has 2 strategies to prevent this, which are to characterize the burden of the dental caries across the lifespan and develop and promote strategies to prevent dental caries. So the CDC is readily aware that 96% of adults aged 50 to 64 have had dental caries, and that tooth decay affects more than 1/4 of the U.S. children aged 2 to 5 and half of the children aged 12 to 15, which covers their first strategy of prevention and control. The data collected has created effective evidence-based strategies to reduce dental caries, such as community water fluorination, which is proven to reduce tooth decay in adults and adolescents by 25% across the lifespan. Studies show, however, that there is still work to be done, as 75 million Americans who receive their water from public water systems still do not receive the correct amount of fluorination in their water to prevent tooth decay. Next, we're going to talk about the prevention and control of periodontal diseases. The CDC has 2 strategies to prevent and control periodontal diseases. One is to improve surveillance of periodontal diseases and to build evidence-based strategies and interventions against periodontal diseases. Severe periodontal diseases affect 4 to 12% of adults, which can lead to tooth loss, impaired dental function, and diminished quality of life. Surveillance of periodontal diseases have proved to be complicated and are not usually covered by state and local surveillance systems. Because this disease is so complicated, the CDC has taken the initiative to work with the American Academy of Periodontology, as well as other agencies, to create avenues of reporting periodontal infections, which will be used in the surveillance and screenings. So once again, the CDC's overall goal is to prevent issues with oral health through education, through resources, and established networks. Thank you for your attention.